All right, guys, we're going to go through an exercise for the lumbar spine, and it's called the lumbar flexion exercise. And there's actually two parts to this. If during your examination and your report of findings you found out that you have too much extension happening in your lumbar spine, then this is something we would recommend for you. So, spine me. What's the problem that we're trying to fix is that sometimes the spine goes too much into extension, where the tailbone comes out a little bit too flat, and then these lumbar segments, they have to extend a lot more than they should in order to bring the spine upright. And this can start to actually wedge out some of these lower segments, and they start to just get pushed forward, which becomes a problem. And this is a very common problem that we see. So the fix for this is starting to bring the lower lumbar spine into a bit more flexion, back to a neutral position. So I'm going to show you two exercises on how to achieve this. One of them is going to be just a very simple child's pose. You're just going to go into a child's pose position. You can see my lumbar spine is starting to get some flexion in it. And you just hang out here. Hold this for 30 seconds, and then you're going to roll over onto your back. Hug your knees into your chest. You can do this either wrapping all the way around or just hold onto your shins. As you can see, my lower pelvis is coming up off the floor as I do this. And if you remember from the spinal model, that's what we want, right? We want to bring that lower spine into a bit more flexion. And you're going to hold this for 30 seconds, and you're just going to cycle back and forth between those two. So 30 seconds, back and forth, and do 5 in total for each of those, and do that twice a day. Thanks.